So we've known about RET-altered non-small cell lung cancer for a few years now, and in the past we were primarily using inhibitors that are not RET-specific but do inhibit other targets. And therefore, the efficacy of these drugs were limited because we were not able to dose these drugs at doses with which these drugs would effectively inhibit RET. And so we saw a lot of toxicities, and the activity was very limited. We have two very exciting drugs that are on the horizon, which have shown very promising activity. What is a very distinctive feature about both these drugs is that they are RET-specific inhibitors, so they do not appear to inhibit other targets to any significant degree, and therefore these drugs are much better tolerated and can be dosed at dose levels that can these drugs can adequately inhibit RET. As a result, we are seeing not only very high response rates, but very durable response rates. And the two drugs are LOXO-292 and BLU-667. At the present time, we have phase 2 data, which I suspect will lead to accelerated approval by the US FDA for both these drugs. At the present time, I'm not sure that I can say the data of one drug is necessarily better than the other, but both drugs look very, very promising. What is also exciting is that we have started understanding if patients progress on these new drugs, what are the mechanisms of resistance? And I can tell you that there are already drugs in development that can potentially target the mechanisms of resistance to these new drugs. So I think we have a lot to look forward to in this space.